Hey everyone, welcome back to my channel, R-EPOCH, where we're going to be talking all about things young adult cancer and nursing content. Today I'm going to be talking about my specific type of cancer, primary mediastinal large B-cell lymphoma. Primary mediastinal large B-cell lymphoma, also known as PMBCL or also PMBL, there's a few different names for it, is a form of non-Hodgkin's lymphoma. Lymphoma is a type of blood cancer. So there's leukemia, lymphoma. I'm sure there's probably some other ones, but those are the two major ones. You may have heard about Hodgkin's lymphoma and non-Hodgkin's lymphoma. There's also a stereotype that Hodgkin's lymphoma only affects younger people and non-Hodgkin's lymphoma only affects older people. A lot of people also believe that Hodgkin's lymphoma is like the quote-unquote better cancer to have between the two. And a lot of these are myths or misleadings is the best way to put it. So I want to talk further about the difference between the two. When a tumor or some sort of abnormality is found and samples are taken, say like of your tumor, your blood, or your bone marrow, it is looked underneath a microscope. The biggest difference between non-Hodgkin's lymphoma and Hodgkin's lymphoma is the presentation of a specific type of cell, which is a whole nother topic in itself. But that is the best way to describe it, is that the biggest difference is a specific type of cell that is present. Through research, we have found that non-Hodgkin's versus Hodgkin's lymphoma isn't like two subtypes of lymphoma, but rather just two ways of describing lymphoma. My type of lymphoma, for example, is considered a form of non-Hodgkin's lymphoma. However, through research and observation, they have found that my specific type of cancer has a lot of qualities shared with Hodgkin's lymphoma. Simply, I don't have the presentation of those cells in Hodgkin's lymphoma. So I have to be classified as a non-Hodgkin's lymphoma. Non-Hodgkin's lymphoma is really just a collection of many different types of lymphomas that can't be classified as Hodgkin's lymphoma. About 80,550 people are diagnosed with non-Hodgkin's lymphoma per year. About 2 to 4% of that 80,000 is diagnosed with my type of cancer, primary mediastinal large B-cell lymphoma, or PMBCL. This is according to the American Cancer Society, by the way. You can find those numbers on their website. This essentially means that about 3,000 people are diagnosed with primary mediastinal large B-cell lymphoma per year. This may sound like a huge number, but when it comes to statistics and the general population, it actually is not. It's a very rare form of cancer. PMBCL originates from your thymus gland and the associated lymphatic system in your chest. Your thymus gland is actually located behind your breastbone, and it is a huge component to your immune system, especially when you're growing up. As you hit puberty and as you age, your thymus gland starts to shrink, and this unfortunately increases your chances of developing cancer cells. People with PMBCL typically are in their late teens, anywhere between their late teens to their early 40s when they develop this type of cancer. In my case, I was 25 years old when I was diagnosed. People with PMBCL typically develop a tumor in their rib cage above their diaphragm. And again, this is associated with that lymphatic system in your chest. And a lot of times they may start to have weird symptoms like a little bit of chest pain, chest pressure, increasing shortness of breath, difficulty breathing. Unfortunately, because they are young and considered quote unquote healthy, a lot of times their symptoms are dismissed until they become severe. A lot of times when people are diagnosed with PMBCL, their tumor will be about 10 centimeters in length, which is very large. Just for visual reference, a deck of cards lengthwise is not even quite 10 centimeters in length. So it's a little bit longer than that, and that's how big this tumor would be. When you have a tumor that is that size, especially when it's in your chest, it starts to create a lot of issues. It can start pushing on your heart, your lungs, different nerves, different arteries, and blood vessels. When I was diagnosed, my tumor, thankfully, the longest it was 9 centimeters. Once a tumor hits about 10 centimeters or greater, it is considered harder to treat, and complications will arise from that. As I mentioned in my diagnosis story, some of the symptoms that I started to experience when I was first diagnosed, well, I should clarify, when they first found my tumor, I had shortness of breath, my neck vein was distended and protruding out. You could actually see it and I could feel it. Later on, while I was waiting to start chemotherapy, the blood was backing up into my head that my face started to swell on the left side of my face, my lips. I had a hard time talking and swallowing because of the back pressure of all the blood. It also caused earaches, headaches, and I had a really hard time breathing, moving around, and I also had an issue with laying flat. So there's a lot of serious symptoms that come with having such a large tumor. My tumor was large enough that it was starting to press on basically a large vein that carries your blood back to your heart. It started to push on that vein called the superior vena cava, which is unfortunately a very common symptom that associates with all of this. I started to also have left arm pain, left shoulder pain, barking, dry cough, that no matter what I did, I could not get rid of it. All of my symptoms probably sound crazy and just like a rare case, just something that is not normal, but when it comes to PMBCL, these are very common symptoms that people experience because either they push their symptoms off for too long or they were dismissed so many times in our healthcare system that their tumor just grew to that size. The average age of people diagnosed with PMBCL is 35 years old. However, I've heard of people in their late teens all the way to early 40s that are diagnosed with this rare disease. A lot of people ask me what caused my cancer. And as difficult it is for me to even say this, there's really no definitive cause of it or predisposing factors. Unlike other types of cancers where weight can affect it, your age, smoking, drinking, none of those seem to be legitimate predisposing factors to my type of cancer. My doctor basically explained it to me as, unfortunately, it's just something that randomly happened, and there was no way that I could have prevented it. It's a real hard pill to swallow because you want to blame yourself, but there's no reason to blame yourself. It randomly happens. For a few different reasons, there's no definitive answer to how we treat this disease. Depending on what country you live in, what doctor is taking care of you, the answer to how we treat this can change from facility to facility or from country to country. Through my research when I was diagnosed, as well as making this video, there are a few major things that stuck out to me when reading the data and research. Number one, PMBCL is a relatively rare disease. As said earlier, roughly only about 3,000 people are diagnosed per year. That is such a small number when we talk about drug trials, observational studies. There's just not a lot of data to go off of. Number two, PMBCL was and continues to sometimes be considered a subtype of a more common type of non-Hodgkin's lymphoma called DLBCL. Prior to 2008, PMBCL was actually considered a subtype of DLBCL, but essentially it caused a lot of issues with data collection and advancement of treatments for people with PMBCL. research has proven that actually PMBCL is a unique form of non-Hodgkin's lymphoma. It shares a lot of characteristics with Hodgkin's lymphoma. Because of all of these unique characteristics, in 2008, the World Health Organization determined PMBCL as its own type of cancer instead of a subtype of DLBCL, which that is really when research took off for my type of cancer, and is a big reason why I am here today. In fact, when I found out my cancer came back, the original plan of care or plan of attack for my cancer was based on studies related to diffuse large B-cell lymphoma. There's a growing amount of evidence and positive stories that I don't necessarily need to go through an auto stem cell transplant in order to treat my cancer for a second time. Thankfully, I was able to get in contact with a research team in Bethesda, Maryland, who they were able to work with my oncologist in coming up with the best plan of attack for me. The third major issue was that previous research often included PMBCL in with DLBCL. Only in the past decade or so, researchers have been finding better ways to treat PMBCL and to how to differentiate between the two different types of cancers. When my cancer became refractory, meaning it came back shortly after successfully completing treatment and having a clean scan, my doctor treated me as like this rare unicorn in the sense of it's just a small percentage of people have gone through this. He was so open to working with a research team through the National Institute of Health to help better care for me, which I am beyond grateful for. But it just goes to show how rare this cancer is, that even a lymphoma specialist in the United States was having difficulty coming up with a plan of attack for this. Despite the lack of support and research and numbers to verify and vet treatment for PMBCL, the survival rate is surprisingly pretty good. It's between 85 and 91%. Including all the studies that I have looked into that date all the way up to 2021. Even though that they're awesome numbers and the survival rates are so good, it does not occur without consequences. There are so many consequences to cancer treatment, especially as a young adult. Due to the unique population with PMBCL, a lot of young adults will have a lot of lasting effects of chemo treatment well into their 70s and 80s. Unlike other cases of cancer where someone might be in their 70s or 80s or older, people who are in their young adult phase, so from late teens to 39 years old, they have the rest of their lives to live, hopefully, as long as they successfully complete treatment. And unfortunately, a lot of these treatments, as you age, you start to get late effects of it. A lot of these treatments can cause other types of cancers. They can cause infertility issues. So if you haven't had your children yet, sometimes that can be an issue. There's just a lot of different issues that we as cancer patients have to live with for the rest of our lives. Because of the amount of radiation and chemotherapy and immunotherapy that I've had, I now will have to start getting, for example, breast MRIs, not just a mammogram, an actual MRI, because now I'm at a higher risk for breast cancer. Therefore, when it comes to cancer treatment, it doesn't matter how treatable the cancer is. It's a huge toll on the cancer patient's body and mind. A lot of times we as a society downplay this because we think to ourselves, you're cured, you're better, it's time to move on. But really, this is something that we have to live with for the rest of our lives. I'm a huge supporter of finding more and better ways to treat PMBCL because not only would it be great to have a near 100% success rate with treatment, but also finding better treatment options that doesn't affect your life so badly would be life-changing. They're all the time coming up with new drugs. I'm currently on a newer drug to hopefully help keep me in remission, that has little side effects so far that I can tell. And as we put more time and research into this, hopefully we are going to find even better, more successful options for cancer treatment. The whole goal of me making these videos is not only to educate other cancer patients, family members, but also the general public and healthcare workers who may not run into my type of cancer very often. I also would like to advocate for young adult cancer survivors, because a lot of times, even though a lot of cancers look very treatable on paper, they come with a lot of consequences I think society could be a lot more open and accepting of, and understanding where these cancer survivors are coming from. If you liked my video, please like and subscribe to my channel to help boost me in the YouTube algorithm.